Hi, my name is Michelle Wehmeyer. I'm the manager for the Sleep Lab services for the Mercy Health System. Sleep apnea is a breathing condition that occurs while you're asleep. It's pauses in your breathing, and there are different causes. So there's obstructive apnea, which is typically a closure of the airway. That's presented by the soft tissues in the airway that are relaxing and closing off while you sleep. There's also central sleep apnea, which is where there's a disconnect between the brain and the body. So the brain's forgetting to tell the body that it needs to take a breath. And then we also have mixed apneas, and those are a combination of obstructive and central events. In order to get diagnosed with sleep apnea, you would come in for a sleep study at one of our sleep centers. We have 4 in the system between 2 states. So you would come in for an overnight procedure. We would have sensors on you from your head to your toes essentially, and we would monitor your breathing along with other variables to see what's going on while you're sleeping. That's typically where the diagnosis of sleep apnea or any other sleep disorders would come from. So the sleep test is actually pretty non-invasive. You have sensors that sit on the surface of your skin. There's no shots, needles, anything like that. We just have electrodes that sit on your skin, and we monitor electricity through the brain and the muscles, and that's how we make any sort of determination. Once you have a diagnosis for sleep apnea, we would look at treatment options, and those can vary depending on the severity of your apnea. It can range from something as simple as a CPAP machine to something a little bit more in depth, which would be an Inspire device. It's an implantable device, which you would work with your physician on for further treatment options. But usually CPAP is the first step, and that's a machine that allows you to breathe at night. So it just inserts forced air to help hold the airway open and keep you breathing as you sleep.